Welcome back. We're joined now by Tiffany Schussler. Dr. Schussler operates a dentistry called Schussler Dentistry in Hebron. Dr. Schussler, welcome to the show.
Thank you. Welcome. Thanks for having me.
Well, we've had an opportunity to go through the facility today, and it just looks terrific. If you would please share with our viewers what makes your dentistry different than others.
I think for me, what sets us apart is our really kind, caring atmosphere. From when you walk into the lobby, we have the blue walls and the soothing aquarium, the area for the kids, our friendly staff that checks you in. And then when you get to the treatment area, everybody's very friendly. They're very calming and soothing. No one's going to try to sell you anything. All we want to do is make sure that you have a good experience and that when you leave here that you're comfortable.
And with the emphasis on the calm, soothing environment, I know that part of the challenge of going to the dentist for many people is that they're nervous about it. How do you help people in that regard?
Well, the first thing we do is we ask patients if they have questions. And if they have questions, we allow enough time for them to get their questions sufficiently answered. Many times, severe nervousness stems from simply not knowing what's going to happen or fear of the unknown. So what we do is we try to explain everything very thoroughly, but in language that people can understand. And then if they still feel like they're very nervous and they need to have a procedure, we do offer laughing gas sedation to kind of help take the edge off of the procedure, ease the nerves, and allow you to get the procedure done without feeling so nervous. And the nice thing about laughing gas is you can have it, you can have your procedure done, and you can drive yourself home, unlike a traditional sedation with an IV where you have to have a driver.
Well, and one of the things we've been talking about on this show is New Year's resolutions, and I know people make them about their appearance and their teeth as well. What services do you offer that can help people in that regard?
Well, certainly the first thing that we do is a thorough diagnosis, assessment of any needs that are there, diagnosis of decay, cleaning up maybe some old fillings that aren't looking so great anymore. After that, some things we can offer that can really brighten your smile would be just some tooth whitening services. And whether it be a box of professional strength white strips, a custom tray fabrication for whitening, or an in-office whitening, any of those things can help brighten up your smile and just give you a little bit of a smile lift for the new year.
When we were talking about the teeth whitening before, about how long would an in-office procedure last?
The procedure takes about 90 minutes, and the results will usually last about 6 months. With an in-office whitening, we do fabricate a set of custom fabricated and fit trays, and you're sent home with some tubes of gel, so you can touch up if you feel like things are getting a little dull in between those visits. You can actually touch up at home.
Oh, that's great. And you know, there's an emphasis on helping people's smiles because people want to be comfortable with their appearance and their smile. What are your other procedures that help people with that?
We have a lot of patients that come to us. They're very ashamed of their smile. Maybe they have some missing teeth or some teeth that are in a state of disrepair. And so often it can be just something as simple as some fillings or some bonding to cover up some stained teeth. We can do replacement services with crowns and bridge work, partial dentures or full dentures, anything that can help somebody get their confidence back in their smile and help them maybe get back that feeling they had when they were younger or things weren't quite as broken down.
Helps change their lives.
It often does change their lives, and sometimes the results are immediate, and it's nice.
Well, we're here with Dr. Schussler at her dentistry. We're going to take a short break, and we'll be right back. Welcome back. We're here again with Dr. Schussler, and we're back in the inner sanctum where Dr. Schussler works. I understand you've had some terrific growth lately at the dentistry. If you would tell our viewers about that.
Absolutely. Recently, within the last 18 months, I've added an associate to my office, Dr. Weisenberger. She'll be joining me as a partner in January, and we were able to completely build out the rest of the office. So we now have 6 treatment rooms. We have 2 full-time hygienists, 2 part-time hygienists, and 2 full-time doctors. So we're here a lot, and we have plenty of room to see any patients that we need.
One, your business model has stretched so far beyond that of just being a general dentistry. If you would tell our viewers about the other services that you offer.
Well, recently, both Dr. Weisenberger and myself have become certified to administer Botox and a dermal filler called Juvederm. Obviously, people hear about those in the news, but what those can do is they can freshen up your face, liven up your appearance, give you a more youthful appearance if you're looking for that. Botox has a second use, though, that we actually use it quite a lot for, and that's to help alleviate problems with tooth grinding. With a couple of small injections right in this area of the cheek, if someone's having severe headaches from tooth grinding, we can actually make the tooth grinding stop for about 90 days.
We've talked about general dentistry and then these other procedures. How do they fit together?
With the Botox and the Juvederm, the nice thing is we can fit that with your cosmetic dentistry if you're interested. A lot of people ask about Botox and Juvederm with dentistry, and when they ask us that, we answer to them, who better than to do it than a dentist? Our main training when we're in dental school is the mouth and all the structures around the mouth. We deal with symmetry of the face and the way that the muscles of the face move, even structures up to and around the ears. So if someone comes to me and they say, I had my teeth whitened, I've had veneers done, I've had bonding, but I'd like my face to look a little softer, then to me it's a no-brainer that I would go ahead and administer some Botox for them. Or if they want some small lines filled in, we could do a little Juvederm filler. With Juvederm, you have to get numb. The procedure's painful otherwise, and those injections are given intraorally. Well, who better to give you an intraoral injection than a dentist that is highly trained to do so?
And you're helping us change the way we view dentistry.
Absolutely.
I understand you're involved in smoking cessation as well, is that right?
We do counsel patients on smoking cessation. We aren't able to prescribe or administer medications, but we always counsel our patients on not just smoking, but smokeless tobacco as well. It is a public health hazard, it's a public health risk, it's a cancer risk, among other things. So we do counsel our patients as to the reasons for quitting and ways to quit.
And other services, I understand, include laser treatments, is that right?
We do. We have soft tissue lasers in the office, and we use those soft tissue lasers for a variety of procedures. Basically, a soft tissue laser means that we just cut soft tissue, no bone or tooth. We can use that to do everything from simply removing a little bit of tissue if there's a little too much. We can use it to help us with our crown preparations for patients. We can use it for some gum therapy, and we can also use it when we're doing certain types of root canals on children. We can also use it to treat what someone would refer to as a cold sore, the little ulcers you get inside your mouth, not the ones on the outside, but the ones on the inside. We can also use it to treat sensitive teeth.
Well, and you're here in Hebron. In January, you have a new business name. Is that right?
That's correct. In January, we'll be changing from Schussler Dentistry to Tri-State Family Dentistry to reflect Dr. Weisenberger coming on as our partner.
And tell our viewers where you're located.
We are located at 1960 North Bend Road in Hebron, Kentucky, in the Rumpke Shopping Plaza, right next door to Rumpke.
Dr. Schussler, thanks so much for sharing information about your practice. Congratulations on your success and Happy New Year.
Thank you. Happy New Year to you as well.